the first, I want to say 5 or so years in practice, I was doing a lot of my own hygiene, both working with my mom and also working as an associate in another practice. So I did so much hygiene and I spent so much time trying to educate my patients on, oral care and brushing and flossing. I realized there was like this big problem, the fact that people weren't flossing, and yet, you know, like here I am just like doing these procedures over and over again. I felt like a broken record. Meanwhile, my practice had grown so much and I got so busy that, I would diagnose like caries or tell people like, okay, you need a crown. But I didn't have time in my own practice to do these procedures anymore because my practice had grown so much and my schedule was so full. So it was a big conflict because, here I am, I'm trying to help people get healthier. And then, yes, they need treatment, but I actually can't even help them. I say like, okay, you need a crown, like, let's do it. And can we do that in 6 months? And it sounds absurd, right? Like if somebody needs a crown, you probably want to schedule it sooner. But I was literally to the point of like, well, my hygiene schedule is so full. And I was doing my own hygiene at the time, which was the problem, but I would schedule my treatment out really far. It's like, okay, this is like a really big problem. People are getting caries, people are still need their teeth cleaned, and and they need treatment, and I have no time to do it. And people really need to start taking care of their teeth and flossing because, even after I restore these teeth, like if they're not flossing, it's just going to fail anyway. And you know how it is. Like if they're not flossing, it makes it so much harder for us to do our work too. So I just felt so frustrated by the fact that, like the flossing is really for the patient. It's not for me. They come to us saying like, telling us like that, yeah, I know you want me to floss, but I haven't done it. It's like, well, it's really on you. It's really not on us. And then of course we're the ones who have to deal with the bleeding gums when we're trying to do a class 2 composite or trying to, restore their beautiful veneers. The gums get in the way if they're not flossing. So just frustration.
So you saw a kind of a pain point or a frustration with what was out there in the market. And did you start to think, hey, I feel like there's a need for something better out there? Is that kind of what the eureka moment was that's kind of sparked you looking into actually creating your own floss?
Yeah, I kept digging into the why. Like I was like, why is it that people aren't flossing? Why is it that like even after I spent all this time, thinking that I've adequately educated my patient on flossing, they still come back 6 months later and they haven't started? Or, why why are we telling people to floss anyway? What is the goal here? So I just kept digging and digging, and I realized there were many problems with floss. One of them is the fact that people never built the habit. Truth is, it's really hard to floss children's teeth. And so if you're not flossing, your children's teeth, they're going to grow up and become adults, and flossing had never become a habit. Flossing also, as it was ineffective. It was pretty ineffective. It's, thin, slippery, and flat. You could succeed at making your gums bleed with a thin, slippery, flat floss, but you're not going to really remove plaque biofilm. People also never really learned how to floss. So yeah, they never built the habit. They never learned how to floss. They never understood the importance of it. So the whole idea of flossing felt like such a chore for people. And they could think of a gazillion other things they'd rather do with that minute of their time. And so I realized like, we really need to change the way people think and feel about floss. We need to make the floss better, and we need to create a floss that people actually want to use.